गुड मॉर्निंग एवरीबॉडी। नमस्कार। मैं चंडीगढ़ से अमरपाल आप लोगों से बात कर रहा हूँ। तो आज थोड़ा आपके बाद एक टॉपिक है और हेल्थ के बारे में, डेंटल हेल्थ के बारे में थोड़ा बातचीत करेंगे। पहले थोड़ा सा एक दो लाइन में आपको बताऊं कि जो कुछ मैं स्पेसिफिक न्यूट्रिशन प्रोग्राम ले रहा हूँ उसका जो इफ़ेक्ट हुआ है थोड़ा उसके बात कर लेते हैं। तो ये जब मैं न्यूट्रिशन प्रोग्राम में स्टार्ट करने से पहले मेरा वजन बहुत ज़्यादा बढ़ा हुआ था, 108 किलोग्राम वजन था। पार्किंसन, हाइपरटेंशन, ये सारी प्रॉब्लम थी। वो कोई मूव नहीं कर सकता था, खाने पीना नहीं है, सोना नहीं है, गुस्सा आना है, बस एक सब कुछ नहीं होता था, सिंपली उड़ना ही आता था। तो खैर जब ये प्रोग्राम लिया, प्रोग्राम से जो भी हुआ, न्यूट्रिशन वगैरह प्रॉपर लिया, अपना लाइफस्टाइल में कुछ चेंजेस किए तो इम्प्रूवमेंट रहा। तो जो हम ओरल कैविटी की हम जब बात करें, हमारा जो ये माउथ है स्टार्ट फ्रॉम लिप्स देन इट इज़ अप टू द थ्रोट। मोस्ट ऑफ द people they think that it is the health of the teeth only, but not. Oral cavity means this teeth health, your gums health, and your this tongue health, then your this mouth top and bottom. So and that is your this saliva gland health. So all this they constitute to come under this oral cavity. तो अब oral cavity में क्या है सबसे बड़ा कि जैसे और बॉडी में हमारे because there are so many bacteria are there. So these bacteria they form some sticky layers on the teeth, and whenever we eat some sugar or carbohydrate, what happens कि वो जो है अपना एसिड का रिलीज करते हैं, they release the acid, so that मतलब destroys the enamel on our teeth. तो ये काम बढ़ता जाता है। तो इसमें जो है स्टार्ट होता है काम जो है ये कैविटी से आता है, टीथ तक है, उसके बाद फिर इन्फेक्शन जो है ये नहीं कंट्रोल में रहती है, देन इट गोज टू and that is your gums, and ultimately it goes to the all over system, that is the system through which our that is this teeth they are connected to the jawbone. So ultimately kya hai now there is another thing which is very specific about this oral cavity. You know that oral cavity, that there is a T junction at the throat level. It has direct connection with our lungs, that is respiratory system, and on the other hand it has direct connection with the our gut health, that is gut health. So whatever infection will be there inside our oral cavity, that will go to our blood, that will create problem there, that will create inflammation in the body. So as a result of inflammation, lot of chronic diseases, they are only result of this inflammation is there. So if you are not taking care of this oral health, so then definitely you may be experiencing this cardiovascular problems, this your cognitive, that is mental health problems, then of course your respiratory infection problem, your oral infection problems, and also there are some oral type cancers are there. So all these they may come because they may result in that, and the reason is that whatever infection is there that goes inside the body, inside the blood, and then that creates the problem. Now if your oral cavity अगर आपकी ठीक नहीं है, तो what is the indications? You may feel pain, swelling on the face, और जब आप जो है टीथ ब्रशिंग करते हो, so then only you will feel that blood is coming, some pus is coming, and moreover if you are eating some cold, then sensitivity of the teeth, झुंझुनाहट होती है दांतों के ऊपर, लगता है वो। फिर सबसे बड़ा क्या है कि आपके पास कोई बैठता नहीं है, कम बैठते हैं, क्योंकि जो है ये जो स्मेल है माउथ की वो भी प्रॉपर नहीं है। तो ऑल दिस प्रॉब्लम्स कम, so because if all these problems are there, if you are, they will come only when your oral health is not proper. Then what is the result? Ultimately your whole life is disturbed, you are having pain, and you are having this bad breath, आपका बदबू आती है, तो who will sit with you? You can't go to interview. अगर से बच्चे के दांत में दर्द हो रहा है, he can't go to school. So your psychological effect will be there, then your mental tension will be there. mental tension होगी आपको, यार मैं किससे बात तो नहीं कर सकता हूँ. So the oral मतलब health जो है ना, it reflects your overall health, and you know that about 3.1 billion persons all over the world they are having this oral problems. So this is the importance of why this oral health is necessary. Now what are the reasons? Reasons क्या हो सकते हैं कि आपकी जो oral health proper नहीं है? तो सबसे पहले तो जो है आपका डेंटल हाइजीन इज़ नॉट प्रॉपर. दैन सेकंड देयर इज डाइट एंड न्यूट्रिशन, आपका डाइट न्यूट्रिशन जो है प्रॉपर नहीं है. देन सम हार्मोन चेंजेस मे बी देयर, देन सम दिस जेनेटिक्स प्रॉब्लम, then of course acid reflux. If there is acid reflux, then also it may create some problem. This, then of course smoking is there. Then this that is diabetes patients, they may also have that. And so these are these are some of the factors. Now very important thing in this oral health is that is for the women. So if they are during pregnancy, जो आपका the sensitivity of the gums, it is more. So there are more chances of infection. So that is premature birth and of less weight. That is that may be that complication may come, वो आ सकता है. और उसके अलावा क्या है ना, आपको ड्यूरिंग प्रेगनेंसी तो there are some morning sicknesses, so vomiting is there. Whenever you vomit, then acid will come in the cavity, this oral cavity, then that will create problem. So that is a special thing. So they must take care of that. And moreover, in this oral health, as far as diet and nutrition is concerned, they have a very important role to play. If your diet and nutrition is not proper, nutrition means your macronutrient, your micronutrient, they are not proper, then it will affect your oral health. And as far as some calcium and phosphorus, they are essential. Then vitamin A, vitamin C is for your gum health. So there are some of the vitamins which you must incorporate in that. So this diet and nutrition plays a part. अगर आपकी if your oral health is not there may are chances of this malnutrition. If you are having pain है, आपको swelling है, infection है, you will not be able to eat. All nutrition आपका macro नहीं जाएंगे आपके. So definitely it is a result of this malnutrition. So it is a both way. If your diet and nutrition they are not proper, then it will affect the oral this health. If your oral health is proper, then you require this proper diet and nutrition. Then another important thing is that your this gland is there, that is salivary gland is there, salivary. तो जो ये मुंह में जो ये salivary बनता है, इसमें इसका मेन इम्पोर्टेंट रोल है. इसका रोल है कि जो एसिड है ना, उसको एक तो जो है खींच के ले जाता है, इसको मतलब टेक इट टू दैट गट. And moreover, इसका जो है ना, of course it has about 70, 80, 90% water is there, but there are some calcium and this that gives help to your that is enamel on the teeth. So it has very important role to play. So therefore, if you are having this problem, that is your dry mouth is there, because there may be different reasons. There are some medicines, mostly antidepressant medicines are there, which causes your dryness of the mouth. So there is no saliva in your mouth. There is no saliva, dryness is there. Then definitely there are very, very much chances of your this oral cavity problems. That is your infection, gum disease or this that. So your that is the health of your this saliva gland, that is there. So as far as diet and nutrition, I have explained other factors. One is important thing is of hydration, because this water is very useful. If you are facing this dry, that is a problem, dry mouth problem, because of some medicines or some other reasons, then easy access to water, you take this water. So if the hydration should be proper, balanced diet, hydration should be proper, and your since the diet of your bacteria, that is sugar, so you have to limit these sugar drinks. Sugar you have to limit as far as your diet is concerned, because that will affect. That will create some more problems. So these are some of the factors. Now इसका solution क्या है? Solution ये है, सबसे पहले तो जो है dental hygiene के ऊपर आप करिए. Dental hygiene में क्या है? Brushing है at least 2 times, morning में और शाम को, रात को जो सोने से पहले ब्रशिंग करिए. उसमें जो है फ्लोराइड का टूथपेस्ट जो है ये हेल्प करेगा, क्योंकि जो फ्लोराइड है ना, इट इज़ एंटीबैक्टीरियल. सो इट विल हेल्प in case there is some infection is there. So and then another thing is you take care of diet and nutrition का आप प्रॉपर ध्यान रखिए, जो आप डाइट एंड न्यूट्रिशन आप ले रहे हो. तो और उसके बाद जो है हाइड्रेशन का है, तो हाइड्रेशन का जो है ना आप ये प्रॉपर रखिए. और फिर जो है ना अगर आपका ड्राई माउथ है, उसके लिए हाइड्रेशन इट इज़ इम्पॉर्टेंट. एंड सपोज मैं इनके आई टोल्ड यू एज फार एज सम विमेन कंसर्न्ड, और बिकॉज फॉर एवरीबॉडी अगर आपका वॉमिटिंग है तो acid from the stomach, it will come out, it will come in the cavity. So that also you should take care. Another important thing is तो आपका जो है डेंटल हेल्थ चेकअप जो है प्रोडिक होना चाहिए, बिकॉज मोस्ट ऑफ द पीपल आई थिंक भाई डेंटिस्ट के पास अवॉइड करते हैं जाने के लिए, क्योंकि ये जो आपका जो टीथ है ना, इट हैज़ दिस 5 डायरेक्शन, यू कांट रिमूव द प्लाको. Plaque means whatever you deposit on the teeth, that you can't remove from all the 5 sides. So if the deposits are gone, the chances of more severe infections are there. So therefore regular dental visit is also a must. So your regular dental visit, your diet and nutrition, your this that is a sugar intake, and of course is other lifestyle changes. So they are very, very essential if you want to keep your this oral health, oral cavity health, that is improve that health. Thank you.